everyone, and thank you for watching this evening. Also, thank you, Dr. Naumann, for being here with us.
Thanks for having me.
Tonight, we're going to be discussing common summertime injuries and illnesses, ways to prevent them, and how our clinic can help. If you have any questions, please write them in the comment section to be addressed at the end. So, Dr. Naumann, one common illness that many swimmers and water lovers may encounter is swimmer's ear. What is swimmer's ear?
Swimmer's ear is the inflammation of the external ear canal. So it's five times more common in swimmers than non-swimmers. And if you think about that ear canal there, it's a great warm, moist environment for bacteria. So I think one of the things that happens with that is when we're swimming or bathing, that water washes out the normal waxes in the ear canal. We often think of earwax as kind of gross and bad, but the reality is it's very protective of that ear canal and the skin in there. So when we're swimming and around water, that washes that water out, that waxes out, and then it leaves the skin exposed, and then it cracks, and there's little furrows happen, and that allows the bacteria to get in there and cause problems.
All right, so what is the difference between swimmer's ear and an ear infection?
Yeah, think about the anatomy here. The external ear is just the ear canal, and then that's divided by the eardrum, the tympanic membrane. And that's a whole membrane. There's nothing that penetrates back and forth. And then on the other side of that is the middle ear. And that's the difference. It's a middle ear infection versus the outer ear infection. So external swimmer's ears on the outside, the middle ear infections on the inside. The middle ear infections are what happens when the toddlers get their ear infections. Occasionally adults, but usually that's the childhood infections.
All right, what are some common symptoms of swimmer's ear?
Pain. The vast majority of people have pain with it. You get ear discharge, drainage from it, decreased hearing. Some people, about 2/3 of people will get itching also. So pain, discharge, decreased hearing over there because all the gunk in there. And the thing that you can figure out the difference is that when you get a swimmer's ear, you can actually push on the ear or pull on the ear, and that actually hurts. So that's a great way for my moms and dads out there when their kids are saying their ear hurts, kind of tug on it, and they will tell you. And if you've ever had swimmer's ear, you don't go tugging on the ear when you have swimmer's ear. That's the easy way to tell the difference between a middle ear infection and an outer ear infection, swimmer's ear.
All right, are there any ways to prevent swimmer's ear?
Yeah, I think, like we kind of said, when you're bathing or swimming, you want to be really careful about the water getting in there. And if you're prone to these, you can wear earplugs, you can wear tight fitting bathing caps. You can even use a little Vaseline to coat the lining of the ear. Use a Q-tip and just put a very thin layer. Don't gop it all in when it's coming out, but just a very thin layer. So that's a good way of keeping that skin protected if you're prone to them. Another thing you can do is after you get out of the shower, out of the river, lake, ocean, is you can use a hair dryer to dry out the ear canal. Put it on lowest setting. Don't want any burned ears coming in here, but a low setting just to dry out that water that way. And of course, the number one thing is avoid using Q-tips after you swim. A lot of people will try to dry out the ears and use Q-tips and kind of rub. And again, there's no wax in there, the oils are already gone, and so you're just creating abrasions, and then that's a great place for bacteria to get into from there. So when that all happens, the other thing you can do, if none of that's working, or another option to do is use acetic acid solution, and you can get that anywhere. You just put a couple drops in after you get out of the water, and that'll work. Or Burroughs solution is another one. So those are good tricks to prevent them.
All right. Another injury that many may encounter is sunburn. What is the best thing to do for relieving sunburn?
Don't get it. Don't. That's the best thing to do. Don't get burned. But I know we all do. We make mistakes and we go out there and we don't think about it. And even when it's cloudy outside, those UV rays are coming through 50 to 80% depending. So even on a cloudy day, you can still get sunburn, believe it or not. So the best thing to do is to keep hydrated and keep the skin moist. That's the best thing. As soon as you start feeling the burn, you come in and within a couple hours, you're like, oh my goodness, here we go. Do that. The other thing is, when I talk about keeping things moist, use aquifer, acid tracin, honey, aloe vera, and certainly some of the topical anti-inflammatories are really good that way. So Motrin's good, aspirin's good, and drink lots of fluids because you're losing lots of water through the skin at that point.
All right. What is the best way to prevent sunburn?
Again, stay away from the sunshine. Of course, that's kind of hard to do. I mean, that's not realistic. We talk about that all the time, but it's not really. Obviously, sunscreens are really, really important. And I know everyone talks about them. And, when I was growing up, we didn't use sunscreens. We just went to the pool and the ocean and got burned, and that was fine. And nowadays, most of our moms are really, really good about that with their children and their dads out there, really good about putting sunscreens on. Remember about the sunscreens is, SPF of 15 to 30 is very, very good. Anything above 50, you're really unlikely to have any kind of benefit. So if you're looking at pricing and costs of these kind of things, you don't need to go 50, 75, 100. There's not a lot of advantage. Most of the time, 15 to 30 is all you really need on this. Make sure you're putting plenty on, you're reapplying it. Some of them say they last forever, but be really careful with that because they usually don't. Remember the sunscreens that are out there usually block the UVB radiation. The UVA radiation is really not blocked by the typical sunscreens that are out there. So if you really are sensitive to the sun and get burned a lot or easy, go with something that's more broad, like the zinc oxide based sunscreens. I know, remember with the white nose, the old lifeguards that used to do that. It's actually really smart, but there's a lot of sunscreens out there now that are zinc oxide based, and that'll protect both UV and UVB. In general, beyond the sunscreens, try to avoid the sun between 10 a.m. and 3 p.m. That's when it's strongest. So if you have that ability and do your yard work or be outside early in the morning or late in the evening, that's always better too. The other thing that I think people forget about is wearing hats and protective clothing. We have a tendency to wear less clothing when it's hot and sunny. I'm thinking it's better for us and will cool off, but the reality is wearing good, cool cotton clothing that has good aeration is really protective from the sun. So long sleeve, long pants, and the old hats. The hat's important. And that's not baseball caps or visors. They are not protective. So you want a hat that has a 3-inch brim, and that's basically the length of your middle finger here. For adults, that's about 3 inches, so that's really easy when you're in the store. Just kind of run your finger around the brim, and if it's all the way around 3 inches or more, you're going to get really good protection. They actually did studies. They put dummies out in the sun and with different brim sizes on them, and what's the best, and 3 inches or more really works well. So wear the hat. I know it's not always cool, but that's really the best way to get away from this on the face, because of course that's where we see most of the sun damage and the sun burns. Sunglasses, don't forget about your sunglasses too.
All right. What are some complications that can occur from severe sunburn?
I think, besides pain and being miserable, and actually can take you out of commission for several days, missing work, missing school, from a bad sunburn. You certainly get dehydrated. You can get muscle aches, muscle cramps. You can actually get extreme cases of kidney disease, kidney damage actually, and certainly you can get scarring. That's the worst case scenario.
All right. If you do not burn easily, is it still recommended to wear sunblock?
That sounds like something my mom would say, back in the old days. Oh, you're tan, don't worry about it. That's not true. Always wear and protect yourself. Anyone can end up with sun-damaged skin, whether it's when you're hurting and from being burned, or if it's from long-term complications with cancers developing.
All right. Lastly, for many beachgoers, jellyfish can be a worry for some. What are some suggestions for relieving jellyfish stings?
Jellyfish. If you didn't grow up in this area around the water, or then you might not know about jellyfish. We also call them stinging nettles or sea nettles. They're those guys that are out there. They're usually in shallow water, and they have that umbrella dome, and that dome can be anywhere from an inch to up to 7 feet in diameter, believe it or not. That's a big jellyfish. The tentacles can be from a couple inches to up to 100 feet long. So they can get quite big. Those tentacles are the problem. The dome itself, if you like to play with them like I did when I was a kid and throw them at my brother, that's not going to sting you. But the tentacles will. They have what they call nematocysts on them, and that's what's going to get you. Those are the stinging parts of the jellyfish. So there's a lot of crazy, interesting ideas out there. I don't even want to say some of them because they're probably not appropriate for this show, that what you can do to relieve yourself from the pain of a stinging nettle. But the best thing to do is use vinegar. So put that in your beach bag. 5% acetic acid or vinegar. Put it right on there for about 30 minutes, and that's actually going to take away those nematocysts. So that's a really good trick. A lot of people will put fresh water. They'll take the water out and douse themselves with it. That's not a good idea. That's actually going to make those nematocysts discharge, and you're going to sting more. So no fresh water with a stinging nettle. The other thing, salt water is a good alternative too, by the way. If you don't have the vinegar, use just cold plain salt water out there to rinse. Those nematocysts and those tentacles kind of can stick to the skin. So you want to get them off, but you got to be careful, because if you use your hands to kind of rub them off, you don't really want to do that. What you want to do is try to get something sharp and kind of scrape them off. So like a credit card, do that kind of thing, and just kind of go into the sand and do it that way, and that'll scrape off those nematocysts off the skin. You don't want to grab them with a towel and start rubbing them, because they're going to burst open and boom, more stinging. So those are the best things to do for it.
Okay. What are some ways that our clinic can help in treating these injuries and illnesses?
Sure. I mean, swimmer's ear, we can certainly diagnose that and get you on the right medicines for it. That's a good one. I kind of gave you a trick. If you know that's happening, get on in, because that's probably not going to go away on its own on home remedies. Swimmer's ear is usually really painful, so most people come right on in for that. Those sunburns, when it gets bad and you're feeling really bad, and it can almost feel like you have the flu. It feels so icky and you feel so bad. We can certainly help you. IV fluids, get you on some medications, prescription medications that can help relieve some of that discomfort. And certainly the bad stinging nettles, jellyfish. We don't see those very often, but it can be bad. You get one of those big tentacles wrapped around you, and it can really get you. So we can certainly help you out with that.
All right, Dr. Naumann, do you have any final thoughts on these topics?
I think, on all of these, just be aware of what's going on. I think in the water, just be aware of those jellyfish. I swim around them all the time. You don't have to be out of the water. You don't have to be scared of them. Just know what they are, and you can see how long those tentacles are, and what, if they're really long, probably get out. But if they're really small little guys, I wouldn't worry about them too much. Have some fun and get in the water. But if it does happen, don't pull out the Worcester sauce or the cold water. Use the vinegar and like a credit card or something. Just kind of scrape them off, and that'll take care of them.
All right. Well, thank you everyone for watching, and thank you, Dr. Naumann.
Thank you.